Welcome to The Planet Forward with Preetha, conversations for a greener future, the place where we ignite discussions and uncover innovations driving us towards sustainability. Every episode, join your host Preetha as we explore the stories, ideas, and pioneers making a real difference in our world. Get ready to be inspired, learn, and be a part of the change that propels us forward to a greener tomorrow.
Welcome back to Planet Forward with Preetha, Conversations for a Greener Future. Today, we are delighted to welcome Mr. Ramesh, the Deputy Director of Education and co-lead of training at the Banyan Academy of Leadership in Mental Health, also known as BALM. Ramesh is not only an educator, but a profound advocate for transformative social work and mental health care. With a rich background in social work and behavioral psychology, Ramesh has dedicated his career to advancing mental health education and training. His work at BALM involves overseeing the Sundaram Fasner School of Social Work and Social Policy, where he plays a pivotal role in shaping the future of mental health professionals through innovative education and training programs. Ramesh's commitment to integrating rigorous academic research with practical applications has significantly contributed to developing effective mental health care delivery systems. His expertise has also made him a key figure in national and international discussions on social work's role in mental health. Today, we dive deep into the world of mental health education, exploring the challenges and opportunities in training the next generation of mental health professionals and understanding how BALM's unique approach is making a difference in the community and beyond. Mr. Ramesh, thank you for joining us today and for your unwavering dedication to mental health and social work education.
Thank you for the opportunity to share our experience. Welcome.
Thank you so much. Thank you so much for joining. So I just want to start because just reading through your biography, when I was given all your biodata, I was like so inspired. So I want to start this whole conversation with inspiration and commitment because it's not a small feat what all of you do at Banyan, especially you. So could you take us back to the beginning of your career in social work focused on mental health? What were the key moments or influences that steered you towards this path?
Thank you. That's a very interesting question. So when I was doing my class 1, my mother received information that there is an organization which is going to support student scholarships. Then I attended the meeting, and they looked at my, the reports, the exam grade report, and they said that they are willing to support because my family had challenges in supporting my education. Though I was studying in a government school with less fees, but still there are other costs involved.
Yes.
So I was, getting support from Guild of Service, the organization. After 12th, they said that no more support because the sponsor said that only up to school education, they can support. But there are money left over from the scholarship that I received. So I continued my education at the college, completed bachelor's in chemistry. Then after that, I wanted to do masters. When I tried some masters in chemistry, I did not get it. Then I noticed a program called MSW. Then I tried to understand what it is. Then I got excited. Then I realized maybe it's a time to give back what I received.
Wonderful. That's what a brilliant and inspiring story, right? Like at a very young age, that too.
Yes.
You decided to pursue something which is completely different than what you did thus far.
Yes.
Only because you have continued your education only because somebody sponsored you.
Yes.
And so now it's time for you to give back. My God, such a beautiful story.
Yes. Then the next interesting thing is when I looked at what are the institutions which is offering these courses, I saw one name called Madras School of Social Work.
Okay.
When I tried to understand where this is located and want to see the place, when I went there, I got a shock, which is because it is just next building to the place where I received a scholarship, that is Guild of Service.
Oh my God, it's right next to it and you didn't notice it until then. Oh
Yeah.
my God. Okay.
And then I realized that there are meetings also during, these scholarship days, that there are meetings conducted in the same building, but I never noticed a name. And I always thought it's a school with the
Okay.
name.
Yeah.
Uh, so that's a
That's
shocking part.
and I think you came full circle, right? Where you
Yes,
started, you came back there. Oh my God.
yes.
Very nice.
Then when I, want to get the application, the staff asked, which one you wanted. I said MSW. They said yes, but MSW has four specializations. Which one you
Okay.
wanted to join? I said I don't know about this course at all first. Then this specialization, I'm not at all, have any idea about this. So can you share what are the specializations? So then they shared human resource management, medical and psychiatric social work, community development, then family and child welfare. Then I said that, can you share something about this background, what it is? They shared some background. Then they also said maybe you should apply for HR, human resource management, because that's where everybody applies and you will get a job placement, higher salary. Then they said, if not, maybe you can look at community development. That's the next, course that will receive lot of application again. Then I said, I don't want to choose both of it, because when everybody is going behind based on the money and the opportunities, maybe I want to take a road which is less traveled.
Oh my
Uh,
God. You had
then
such a vision at a very young age. I can't believe that. Typically, these kind of things only come when you're in your middle age. That's when people think, okay, now what can I give back? At least that has been the trend. But you're like literally like 21 years old, and you're like
yes.
talking about things. Oh my God, this is wonderful.
Then the next two choices were medical and psychiatry and family and child welfare. I said, maybe I don't want to be biased. Maybe I will, choose by putting a chit. I wrote two chits,
Oh
medical and
my.
psychiatry and family and child welfare. In front of them, I took one which said medical and psychiatry, and that's how I entered.
Oh my God, what a beautiful story. And you went on to do masters in that. Oh my
Yes.
God. I wonder. And the rest is history, right?
Yes. Then I got so fascinated, with this medical and psychiatric social work, especially mental health, because I had an opportunity to visit the Banyan in 1998
The
as
initial
part
days
of
when
the.
Banyan was
Yes,
started.
it was just
Okay.
5 years old. They were in a rented building in the Chennai city, where they had around 20-25 in a small, house. Then I got a lot of interest. Then after that, we were taken to another government institute of mental health, which is very big, like 1,700 residents and things
Oh
like that.
my God.
Then my field work was at Scarf India in Chennai, which is another mental health setting. So these are the three which ignited my interest, especially in health, but again
In mental health.
mental health.
What I'm, see, in India specifically, right? Mental health till date is a taboo. It's not a widely spoken thing. People go to a doctor for any other ailment in your body, not for your head. They think head is dead, that does not require a doctor. But any other ailment you have below your neck, people will go. Above your neck, it's like a hush hush thing. It's behind the doors, and they don't want to discuss that you have some. But that also is an organ in your body, which also
Yeah.
requires medicines and also other social factors which contributes to it. So this is 98 you're talking about. Even then you
Yes.
had such a vision where I don't know how you would have even convinced your family that you're going into this kind of line of work. For them it'll be like, what happened to you?
That's actually another interesting when I shared this with my mother, because my mother was a non-formal education teacher in
Okay.
1980s. She teach many people in my neighborhood, which is actually called as a slum, dwelling. So she taught many, who were not educated. She was teaching basics, So she was called as a teacher in my entire neighborhood, and then went on
Oh,
running a crush under another NGO, Women's Indian Association, Women's Voluntary Service. So she actually, when I said that I want to join this, and she supported it fully.
oh my God!
Uh,
You have such a you have a really good pedigree, I should say. Your mother, who has
yes,
inspired you, she's been a role model. Like she
yes,
went the unconventional way, not what
yes,
anybody would go the conventional way. Like so, there's no there's a saying, right? The apple does
yeah,
not fall far away from the tree. I guess you have taken after your mom.
correct, 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 correct,
That
correct,
is
correct.
wonderful. Very nice.
Yeah,
So that's a very inspiring story. That's why I was very when I was writing the questions, I was like, just reading through what you've done. I was like, I want to start the questions with inspiration. I'm glad I did that. It's beautiful.
thank you, thank you.
So continuing with that, right? So throughout your tenure at BALM and your previous roles, there must be countless stories that have touched your heart. Could you share one such story that profoundly impacted you and perhaps reshaped your approach to mental health education and training?
Before that, just want to share one interesting thing is when I was completing my master's education, I
Yeah.
was informed that the Banyan will come for a campus placement.
Okay.
I was
Beautiful.
waiting for that opportunity, but unfortunately, that time Banyan was not able to recruit anybody. Maybe shortage of fund. I was not aware of it. So then it took nearly 13 years, to come back to
To Banyan.
Banyan.
But you had it in your heart always,
Yes,
especially when
yes,
you did the field visit and all that. You said Banyan
yes,
was one of the center which inspired you. So I
yes,
guess you did not let go of it. You had that desire still in you. So it took 13
yes,
years to come back. What a
yes.
wonderful story. I'm so happy to hear that.
and and in between also there were some opportunities to another psychiatrist, because they were running outpatient clinics in another college. So when I visited that college, I came to know that there is a OP running here by Banyan. So I just, with that all the interest, I went there. Then the psychiatrist said, oh, you can continue as a volunteer, you don't have to be always be an employee to contribute, so why don't you come? So I started attending those OP clinics in the evening, try to support them.
Wow.
Then I joined the volunteer group, and we were running a mental health related training program for this Anganwadi
Yeah.
staff.
Okay.
Uh, and I have not even entered the Banyan. It's all happening outside the Banyan building, but part of a Banyan activity. So
As a
many people,
volunteer.
many people at Banyan don't know that I was doing this. Only when I joined, when I shared, they said, "Oh, we are not aware of it," and things like that. So that
So
was
you
again
were part of Banyan in a very indirect way, and then
yes,
you directly became beautiful,
yes,
beautiful, inspiring story.
yes. So the one thing that, like you said, that which helped me to look at this mental health as my passion, and maybe even one day when I told my son, he asked me, "You have only 10 more years." For your retirement, I said, till my, death, nobody can separate me from the Banyan.
Oh my God! So you were till the last breath, you want to be part of Banyan, always making sure
Yes,
that you're
yeah,
contributing. See, that shows your commitment and how connected you are to the cause what Banyan stands for. That is more important, right? Unless you
yes,
are passionate about what you do, you cannot, even think of doing it till your last breath. So
yes.
you're not looking this as a profession. This is your
No,
life.
no, yes, that's a life. So when I joined, Banyan Academy, I was told that I will get an opportunity both, teaching, research, practice, social action, policy development, all this. And so I felt so good, with that kind of opportunities, because my past opportunities were either teaching or only a practice or only a research.
It was like only one particular thing. You didn't get to have this diverse
Yes,
experience.
yes, which is very important, in any, professional, work.
Absolutely. Very true.
So I felt so good. But this one incident, just want to share, because you asked about one
Yes.
inspiring thing.
Yes.
I met one of the client. She's from West Bengal. She speaks Bengali. But when she was rescued, she was pregnant, and she
Okay.
delivered a child in our own center. The child knows only Tamil.
Oh my God. And how did the mother and child
Yeah.
communicate?
So they both interact without a language, with a sign, which when I saw it, I really was in tears.
Oh my God. Oh, why? Is it because she could not teach the child Bengali?
Yes, because she usually don't speak much,
Oh,
is
she's
one.
going, yeah.
Yeah, and the child is always under the care of other staff and all, anybody who comes into her facility. Because very young child, everybody starts interacting with her and she starts playing. So she knows only, Tamil.
Tamil. But what an inspiring story, right? Like,
Yes,
yeah, that will move because so she was on the streets. You rescued her, rehabilitated, and
yes,
then and she's communicating to her child using sign
yes,
language. Oh my
yes,
God, what a profound way! I think that nothing can be more inspiring than that,
yes,
because
yes,
if you want to show or see the impact of your work, these are the kind
yeah,
of things that will, at least for me, I feel if I were in that space, I would say this is worth living your life.
yes,
And because
yes,
there's so much of satisfaction you get.
yes, yes,
You're doing something, you're purposeful, and you're impacting a life in a very positive way. In this
correct.
case scenario, two lives, not just one,
Yes,
two.
yes. And
Oh,
I'm seeing the child after 11 years now. And after 11 years, I see her regularly. But now she's, like 12, 13. She's doing her education and, she's doing well and she's interested in, arts. So I see that as an, okay, what a remarkable, transformation for the child. When
definitely.
and I felt also when the founders initiated this, they were not given any kind of compensation, whether it's a salary or any form of. It's only satisfaction they derived, and they were
Yes.
able to sustain this movement. Now I am just an employee. Drawing a salary, but at least it's an opportunity for me to contribute to what they are doing. So what else I can get in my lifetime other than this?
What a beautiful way to say that. Really, see, um, many people, if they consider this as a 9 to 5 job just for the sake of getting a remuneration, you wouldn't even know the impact you're creating. For you, it's just like going to the office, get your hours done, and you walk away. But every single day, you get to see the impact what you're doing. Like you rightfully said, right? When Vandana and Vaishnavi started this, the only mission for them was to help people. They wanted to ensure that these men and women on the streets are rescued and rehabilitated. I don't think they even thought about their well being, their
Yeah.
remuneration. They didn't understand the how. They only knew the
Yes.
what, and the rest of the
Yes.
things fell in place. And I guess
Yes.
that is the reason why uh, people like you joined Banyan. The right people
Yeah.
came because their vision and their purpose was so strong. And so people like you who has a very strong purpose of giving back came and joined, because I was looking at all the bios of all the people. The average tenure is 20 years there,
Yes.
and people have like come there, and I've interviewed a couple more individuals, and they just love it there. And some person, this is
Yes.
their first job. They're like, I
Yes.
don't want to go at all. So that
Correct.
speaks volume about the impact what Banyan is doing and how
Yes.
committed are each and every individual who is part of Banyan.
Yes.
Oh,
Yes.
such an inspiring story. Thank you so much. So I want to ask you, like you said, other jobs prior to Banyan, where you only had to do like one role, either teaching or research and things like that. So now Banyan, you get to have like an all-rounded approach, right? So uh, it gives you an opportunity to bridge theory and practice.
Yeah.
So your work involves a seamless blend of academic research and its practical applications, especially in a dynamic setting like the Banyan. How do you
Yes.
translate complex research findings into actionable strategies? Could you walk us through the process of integrating these insights into BALM's training programs?
Definitely. So when I joined, there was one study going on, which is a community mental health care. We called it as a NALAM program, because
Okay.
India had a shortage of the so-called mental health professionals, psychiatrists, psychologists, social workers, nurses, and even other allied professionals. So Banyan initiated this project wherein they trained one community worker in each village level panchayat. Through them, the awareness, identification, referral and follow up, and then the social care component that they need, and even addressing the causative factors behind the reason why they got into mental health problems. So this was one attempt was done with the funding from the Grand Challenges Canada. So what happened is, after nearly 1 or 2 years of this trial, we realized that this is a way that we should move ahead, because a lot of transformation we see in the, because it's action research, because
Yes.
you have nearly 50 panchayats in that Tirupur block in near Chennai, where one person from each panchayat trained, and suddenly you see a transformation in the village, and everybody come to know what is mental health, where to go in case of mental health problem, things like that were happening. So we started continuing the program till date,
It's like
nearly after
you're
10 or 11
empowering the
years.
local people, you're empowering the
Yes,
village to
yes,
be self sufficient rather than
correct.
looking outside for help. You're
Yes,
actually picking one among their
yes,
own tribe, making
yes,
sure they're fully trained. So they know, like, they have a problem, they know who to reach out to. My God, that's a
yes,
brilliant way to
yes.
do it.
And that resulted in lot of people knowing about this initiative, which we then realized maybe we should convert this into a learning kind of pedagogy. So we named it as a diploma in community mental health care, and then we said that we will start offering this to other locations where we may not have our own services, but at least we leave people trained in their own community, so that other employers can absorb. It can be a government, it can be other NGOs, or even NGOs who have a staff but not trained in mental health. So when we developed this first
Curriculum.
diploma, then immediately Rajiv Gandhi National Institute of Youth Development, it's a Government of India special status institute. The director came to know about this, and they said, "Oh, we will take care of all the expenses of running this program. So you just start recruiting the students."
Oh my
When
God, what a brilliant thing.
So we said, oh, that's a good opportunity, and they're going to certify also, because that's another very important, recognition that any program needs. You need a
Yeah.
stamp from a university, and that's a government university.
What more you
Then,
want?
then we thought, okay, which population that we should focus. In the meantime, our own team is interacting with different government department. They came to know that this is available. That program is called Pudu Valvu Tittam. It's by the government of Tamil Nadu. What they do is they again similarly select people from the community who will work with the disabilities, people with the disabilities. They are referred to different schemes or any care and treatment, follow up service and things like that. So they immediately said that we will send the entire batch. That is, our batch size is 30. They said that the entire batch, we will send it. They had a program all over Tamil Nadu, but we said that 30 people. Then we said maybe a block level you can find 30 people. So they said that, okay, there is a Kundratur block, we have 30 people, so can you do this? Then we said, can they travel to our own location? That's one question that we had it in our mind. Then we said, okay, why not we go to their location? So why always education institutions should always think that we have a campus, we have a classroom, everybody should be here, things like that. So why don't we
Change
go to
the script. We go there, right? Exactly. Let's be innovative.
So they were surprised, with that, suggestion. They said, okay, we will arrange a space. Then we said that we will arrange all the electronic equipments. We will carry, whatever needed, projector, audio equipments, to run a class, whatever is needed. So we had a team. Even our librarian said that we will keep a mobile library. Every class we will take 30 books. which will go there and we will set up, and so that they start reading, because any program needs all this kind of facilities.
Facilities, yes.
So we try to, accommodate all this kind of needs in a mobile form, and it was so successful. And they said that, can you, come to another block,
Wow.
after that. And the challenge that, we had is, at the time, moving to another block again, the distance was one challenge we had, so that required a lot more funding, which that university had some challenges. But they said, instead of, going behind only one program, so why don't you cover, your own neighborhood first, your own work location, why don't you offer that program, because it's not only your staff needed, maybe some other team needed. Then I said, yes, that's very important. So then we covered all the neighborhood, Chennai, Kanjipuram, Tiruvallur districts. We started covering, one by one. Hearing this, suddenly we received one call from Sri Lanka, because one of the psychiatrist from Sri Lanka attended one of our conference, and he came to know about this program. He said that, can you do this program in northern province in Sri Lanka?
Wow.
Because there is a need for this kind of services, especially after the war.
War, after post-war. Yes,
Yes, there are a
definitely.
lot of mental health issues and things like that. They said that we have a ready-made community mental health care, team, but the only challenge is they are not trained. We never thought of training. That's a problem, they said. We just trained in simple, concepts and then asked them to work, but they always find it difficult. But you have a formal, program, so why don't you do it? We said yes, definitely. And again, they try to find a funder, because we have limitations, because Indian CSR funds, you may be aware that
Yes,
you may
I
not be
know.
able to
To take it
use it for
offshore. Yes.
offshore. So we had some constraints. Then they said that we will, reach out to some funders, and then they identified a funder from Netherlands, and who were, once they listened to, the background of this curriculum and what we achieved, nearly this happened in 2020. And they said that we will fund, the team can travel to, Sri Lanka, we will take care of all their accommodation, all the expenses. Then this COVID, came into the picture.
Oh, so you were not able to go then?
We were not able to go, but we said, again, it's a we can call it as a problem, but we can also call it as a challenge. So it's
Yes.
a time now, maybe we should get into technology.
So
So
Zoom.
we said, yeah, we said that we will, do it online. What you do is you accumulate, because they're all from different packets and even within the northern province. So we said that maybe in each, location, you accumulate 5 to 6 people, try to set up these devices, and, then they can join, Zoom, and then we can start teaching. And then we told the same to the funder also, said that, can you help them to, provide the tablets or that video, internet equipment? They said, definitely, no
Wow.
questions.
So instead of you guys going in person, you're willing to buy all the technology like
Yes,
for required
yes,
for this. Such a
yes.
brilliant way to do it.
So 50 people, were trained, and the way they, showed interest, the way they followed up on all the assignments, because it's not just a teaching, this entire program. This program is more than a teaching. We share examples. We invite our own, team members who are working at the grassroots level. They start teaching, and the Tamil was a common language, so
So
there
it
was
was so
some
easy
kind
to
of
communicate.
comfort, happen. So every class followed by a field assignment. So every class after that, based on that, they are given an assignment which they will do it in that week. The next week they will come and discuss in the class. So
So
that's a
you actually
pedagogy.
just came up with a completely, what is it, online university, which,
Yes,
they say the necessity is the mother of invention, they say, right?
correct, correct.
So that was what happened, right? At that point, COVID, you cannot travel, but then you came up with,
Yes,
like you said, it's a challenge. And so you have to say, how do you overcome that challenge?
yes,
And you found a
yes,
path. Brilliant.
yes.
So you not only did it in Tamil Nadu, you also went beyond the borders and you went to Sri Lanka also.
Then hearing this, next, request was from Bangladesh.
Wow. So you went there also.
They also said, the same COVID time, the same problem.
So
We said that
online,
now we have experience of online. The only challenge now is they follow Bangla.
the language.
So you cannot do it directly in Bangla. So again, a problem, but again seen as a challenge. We said training of trainer. You bring people in your own team who knows English, who have some background of mental health. We do the training of training. Then they will do the
Oh, the
training directly.
train the trainer concept.
Yes,
Beautiful. So you
and
still were able to find a solution for
yes.
that problem. Very
So,
nice.
so we then they also felt there is a need for supervision for these trainers when they are actually executing the program, because there will be a lot of challenges when you implement.
Yeah, each case is
So
different.
that also happened. So just giving you one example, each program followed the similar thing, because we have program on each and every model that we do. The one is this Nalam, the same thing on home again. Then the next one is emergency care and recovery center. So each one followed the same route. But just to share, because of the time that we have, so I'm
Yeah.
just sharing with you. So far we have completed 13 batches in the last 7 years, 9 years actually. Over 350 people are trained in Tamil Nadu, Bangladesh, and Sri Lanka. Now, knowing about this entire training as well as the implementation, we got a grant from Infosys Foundation to
Wow.
scale it up, in other states as well. So we already have one implementation happening in Maharashtra. Now two more states, which is Odisha and Madhya Pradesh, is joining from this month
Beautiful.
onwards. And
What a
then
brilliant way.
Kerala government has invited us now to incorporate the same training for their Kudumbashri community counselors.
Yes, that's part
So
of
we
the Kerala government initiative.
Yes, yes. So they said that they have 50 lakh Kudumbashri members in the Kerala. So they said that we will pilot it using one district with 30 community councillors. There are nearly 300 community councillors across the Kerala state. So now we are in the process of negotiating on the terms and conditions. So maybe which will result into maybe another 5 years time, maybe the entire Kerala may be covered under this program.
I just want to say my heartfelt gratitude for all what you guys are doing. You have no idea how many lives are getting transformed because of the initiatives what you're doing. See, everybody can donate money, like you said. The foundations can come and give money, which is good, which we need that. But actually going on the ground, boots on the ground, doing this, and also making sure that your whatever you're teaching or imparting is actually given the right way, and to see the success stories after it, that is beyond something. And that takes a lot of heart to do such a work. It's not, you like I told in the earlier questions when we answered also, like, it has to be a passion. This cannot be a job. Only then this kind of a result will happen. So heartfelt gratitude. I am so blessed that I got to meet you today, and I'm learning a lot of things what you're doing. So I want to ask the next, is the vision for future education, like looking ahead. What are your aspirations for the future of mental health education at BALM? Are there new areas of research or training you're excited to explore? Other than what you just said, is there anything like completely, totally different you're, experimenting and you want to share something? I'd love to know that.
Definitely. By understanding the need at the field, so we started designing the curriculum. So we also realized one curriculum, like one size doesn't fit for all. So we also realized that there may be a need for a specialized a context or a setting or even an age group. So one group that we identified as a children. Children living in a vulnerable context. So what happens to them, how we need to promote mental well-being for those children, how we can attempt preventive efforts for the children at risk for mental disorders. What about children who already have mental health problems? So how do you screen, how do you identify, how do you refer them to care, and how can we follow up with the children who need such care? and things like that. So that's one area that we want to initiate based on, again, the experience that we have, the child that I referred to, the child living with us. So we call these children are like kind of vulnerable children, because lack of parental care. Again, I said the language may be a challenge. It can be a culture. It can be even other contexts, like a children with disabilities, children with a chronic or a terminal illness, example HIV, example cancer. And then we also identified one group is children who are homeless. They're just living on the street. We thought maybe it's a right time to get into that area as well, because there are a lot of people already working with children, a lot of NGOs, a lot of focus on children. So can we do one contribution by empowering them in the area of mental health care? That was one thought
Oh my
we
God,
had.
what a brilliant! I'm tearing up just listening to it, because that's so dear and near to my heart. One thing I want to do in my lifetime is to help children on the streets. I don't know how. That is something which is I've written in my own vision board, saying that before I pass on, I want to do something for them. Because every time I come to India, I see the number of kids on the street, and I'm like really touched. And I'm like, what can I do to help them? We are also privileged. We are living such a privileged life, but and like you said, food and other things, but basics, the mental stability is completely altered. And I always think, what can we do to help them? And just hearing you, I'm so teared up, because that is something which I'm so passionate about, and I want to do something for that, and I don't know how. Maybe the divine is just connecting me with you. I don't know. But if there's something that I can do in my capacity, I don't know. But this will be something which I'd love to be part of, and do something, because children are, they are another form of God. That's how I see. And if there's something that we can do to save them, oh my God, bless your heart for just telling me that, because I just got teared up just listening to it. But thank you so much for doing it. And because that's the need of the hour. And there are so many children who are exploited in our country, and their mental stability is all over the place. And if this program, what you are envisioning, can even help children, overcome that, understand how to stand on their own feet, irrespective of what their circumstances are. Oh my God, can you imagine the future of this world if we can take care of our children?
Yes,
That's
true.
brilliant.
So one challenge we had was, our entire, work was based on mental health and, homelessness, poverty, remote tribal rural population. So we thought it's better to, have some kind of knowledge partner or technical partner, somebody who has experience with the children. So then, when we are thinking about this, again, like you said, we got connected with an organization called Rainbow Homes,
Okay.
who run centers across the country for homeless children. And they have nearly 5,000 plus children in their, service network.
Wow, where are they
And
based at?
they are based in Hyderabad, but they have all over India. They have, centers. So they reached out to us, again, connection, mutual connections, and they showed us, can we do something for children? I said that we are already thinking about it, but we were hesitating because we need more, knowledge input and experiential input on this sector. They said that we are there for it. So
But,
then we,
see, the right people will come when your intent is
yes,
pure. The universe conspires to bring everything to fruition. And
yes,
I believe that, because
yes.
your intent is pure. You just found the right partner.
So with that, we developed a program called Diploma in Working with Vulnerable Children. We started, offering it to, the NGO staff or those who is interested in working with children, even somebody who's studying about children, volunteering in any context, any background. Even we had some students where the parents who had a, child with a disability, they don't know how to manage. So there are different. Suddenly we realize that this need is huge. the kind of people who want to go through this education is beyond what we had conceptualized as audience. So we started this program. 2 batches were running. Again, the COVID interrupted. Again, we tried to do it online. Then we also realized that children, I think we should be more focus sensitive. I think sometimes online program has a risk, that once you complete, you may think that you got everything and you may do harm in your
True
work.
that. And
So
then
we
the
said,
attention span also, right?
yes, yes,
Because children, especially in that age,
yes,
having a face-to-face interaction benefits a lot versus
yes.
the internet. Yeah.
Yeah, so it can be hybrid, if there
Yeah.
is a challenge and things like that. So then we had a tentative, pause till the COVID, completed. Then we started again. But what happened is in between, we also said maybe it's a right time to reflect on based on these 2 batches, how it went, whether this is a right, curriculum. Are we focusing on what is missing, or are we trying to, bring in so many components, which otherwise may be there in other curriculum. Then we try to work on it. Then we renamed the name recently and said that it is a diploma, in mental well-being for vulnerable children,
Oh,
not a
mental
just
well.
general work with
Beautiful.
vulnerable children. So it
It's
should be
mental
focused.
focused mental
Yeah,
well-being.
focused.
Beautiful. What? So I'm really, really so touched of all the things you said today. This is the biggest highlight for me because children are the future of this world, and if we can take care of them, we are living this universe in such a better hand. So
Yes.
thank you so much for all what you do.
Thank you, thank you. And
So
following that,
yeah.
just only one addition is we, based on this, we promoted one more idea called Learning Center, which we tried in rural areas earlier. There were 700 children. After the schooling, they turn up to each village level small center. There is one person who will try to support few academic related guidance, but the other purpose is allowing them to play, allowing them to interact, attending life skill training, career counseling, career guidance, all this were part of that idea. So we are continuing that in urban area this year. So that's a new project coming up for the
Wow,
children.
beautiful, brilliant. You're showing them how to fish also. You're not just giving them a fish. Because that is more important. That's the sustainable way. That is how they will learn how to live in this universe, right? So that is to me sustainability in the right form, because you're giving them the tools how to live in this world as well. Such a beautiful
Thank
way.
you.
So the last question I have for you,
Please.
I have been so inspired talking to you today. So I really want this, webinar podcast to actually go for a long time. But then I'm making sure it's within the timeline as well. So the last question I have is I just want to know about your personal philosophy and guidance. Over the years, you transitioned to different roles. So in your journey so far, what philosophies have guided you the most in your professional life? How would you advise new social workers entering the field of mental health based on your experience and learnings?
It's a very important question. Even I need to reflect immediately after your question. Is one, what I felt is I grew up to the status where I am today, because not because just my own effort, my own family. There are so many people, so many resources are used. Not beyond the human resource. Also, I'm saying the environment, the physical. It can be the even animal. All this have contributed to me. So there is no way that I can say that I don't want to return the same to every this creature or environment, including a human being. So that's one philosophy always guides me, that I am not doing this alone. I'm a result of so many contributions from everybody. So that's one. Second is you need a limited resources for your life, whether it's money, whether it's a time, whether it's any other resource and things like that. So maybe a optimal utilization of all these resources in a very productive way, meaningful way, which at least not just not harming, at least contributing to others' well-being. If that idea is followed by everybody, then the world will be a better world, to live. I think these two are, two guiding, principles that I keep it in my mind whenever I wake up, whenever I go for a sleep, because you never know whether you will wake up in the morning or whether you go to sleep after a day.
You are such a blessed soul. I have to say that because not many people will have this kind of thought process, because we're all running after something as human beings, not realizing what we're running after. But like you said, everything in our life is finite. We have very little time. We all have to go when, it's time for us to go. And whatever we try to accumulate in materialistic wealth, not a single thing we can take back. But we're running after that materialistic wealth. But whatever we acquire here, knowledge, which can be imparted and shared with others who do not have that. That's the true form of giving back. And when I speak about planet forward, this is what is planet forward for me, because how will this world propel forward? We have to think in how we as human beings, we're going to help each other. And you just brought a profound vision. And you think what you said, I tell my children at home, like, no guarantee that you're going to wake up tomorrow morning. We all anticipate and wish that we wake up. So every single day, what you're living is a gift. It's a prize. It's like a bumper prize for you. Just live for today and do the best you can and make sure that you're impacting somebody in a positive way. If you can't do that, don't do harm. Just stay neutral at least, but just don't harm. So that's my only humble request. I tell this to my children always. And just hearing that from you is like, so it's like music to my ears. And there's a reason why you're in this profession, because, people like you are like so scarce in this world. And there should be more people in this world like you. So thank you for so much for all what you do. So as we wrap up today's enriching conversation with Mr. Ramesh, I'm reminded of the incredible power of dedicated individuals in shaping the future of mental health care. Ramesh, your insights into the intersection of education, research, and practice have not only enlightened us, but have shown us the profound impact of thoughtful, evidence-based interventions in mental health. So as a parting, a parting way, do you have anything to say for us?
Thank you for all the insightful questions, because many of the times, questions are the reasons to get a right answer, or even answers which can help others to understand things, better. I think all your questions are well thought, and it also helped me to reflect my entire journey. And also it assures me that, the path that I have taken, which I thought it was less travel, now more people are going to travel.
Yes.
Happy to note that. Thank you for the opportunity.
I am so happy that I was able to do it. And when I was writing your questions, based on the bio I got, I made sure that I was able to extract everything from you. And I think I was successful in doing that. I'm so grateful that you came and you shared with us. To our listeners, thank you for joining us on this journey of discovery and understanding. We hope today's discussion inspires you to think more deeply about the role each of us can play in supporting mental health initiatives and the importance of informed, compassionate approaches in this vital sector. Remember, each conversation, each story shared, and each lesson learned brings us closer to a more empathetic and informed society. Keep pushing forward, keep learning, and continue support those making a difference. Until next time, this is Preetha from Planet Forward with Preetha, Conversations for a Greener Future, reminding you to keep looking forward, because every small step in awareness and action leads to substantial change. Goodbye and take care.
Thank you for tuning in to the Planet Forward with Preetha, Conversations for a Greener Future. Together, we're exploring the innovations and stories that inspire us to think and act for a sustainable world. If you're inspired by today's conversation and want to be part of this journey toward a greener future, make sure to subscribe to our podcast on your favorite platform. By subscribing, you'll never miss an episode filled with groundbreaking ideas and actionable solutions. Let's continue to make a difference, one episode at a time. I'm Preetha, reminding you to make every day count for our planet. Until next time, keep moving the planet forward.